Mrs. White. How are you doing today?
Pretty good.
Good. So you just saw your doctor about your congestive heart failure, and he talked about putting you on some furosemide to kind of get rid of that excess fluid that you've been accumulating. It's been making it hard for you to breathe. Is that right? All right. Well, we're just going to go over that a little bit more and answer any questions you have about that. And I gave you a handout because you mentioned that you like explanations, and that usually works best for you to understand the information. Is that right?
Yep, that's
awesome.
right.
Great. Just a couple quick questions. Do you have any allergies to any sulfonamides at all?
No.
No? Okay. And any history of liver disease?
No.
Kidney disease?
Nope.
And diabetes mellitus?
Yes, I have type 2.
Okay. And we'll go ahead and we'll talk about that a little bit later.
Okay.
And how that's going to play into your medication. So the reason that the doctor prescribed this to you was to, like I said earlier, kind of get rid of that excess fluid that's been accumulating, especially on your chest. And so what this pill is going to do is it's going to go ahead and pull the sodium out, and it's going to cause you to go to the bathroom more and kind of get rid of that extra fluid. And with that, though, we kind of have to keep an eye on the fact that you're going to lose some of your other electrolytes, such as potassium and stuff like that. So we want to go ahead and keep an eye on that. You may have heard this medication called the water pill before.
Yes.
Yep, kind of get rid of all that extra fluid. So the doctor went ahead and prescribed you 20 milligrams every day per oral, so just that one pill a day. And the onset's going to be within 60 minutes, and then it's going to peak at 1 to 2 hours and then last for about 6 to 8 hours. And then when you're taking that, it might help to take it with a glass of milk or eat it with your food, and that'll kind of help with any of the GI distress that you're going to get with that as a possible side effect. And then you're not on any digoxin?
No.
Or other ototoxic drugs?
No.
Okay. And we're not taking that with any other diuretics, so we should be fine there. Possible side effects you might experience would be lightheadedness, headache, blurred vision, hypotension, abdominal pain, and dehydration. And with the dehydration, you're going to notice excess thirst. You might be going to the bathroom less. And we want to know if you're vomiting, sweating excessively, or have diarrhea for an extended amount of time, because that's also going to lead to dehydration, and we really want to keep an eye on your fluid balance.
Okay.
Other things that you should report to your doctor would be a rash, because that could indicate that there's the possibility of Stevens-Johnson syndrome, which we would want to know about and treat, as well as any muscle weakness, cramping, nausea, dizziness, cardiac dysrhythmias, numbness and tingling of the extremities, because that can mean that you have an electrolyte imbalance, and we would want to go ahead and treat that as well to prevent any further complications. Okay, and just a few other things we want to talk about. Go ahead and take the furosemide as directed, just like you would with any of your other medications that the doctor prescribes. And if you miss a dose, go ahead and take it as soon as possible, but don't double up on your doses. And with this, again, the fluid balance is a little bit off, so your blood pressure can fluctuate a little bit. So when you're standing or sitting, maybe take that a little more slowly so you're not getting too dizzy, and we don't want you falling or anything. All right, go ahead and flip the page there. Yep. And again, we just want to report any of those adverse effects we talked about earlier. And since you have diabetes, Lasix can affect your blood sugar a little bit more. So you want to go ahead and make sure that you stay on top of your blood glucose checks and adjust your medication as the doctor has talked to you about. Okay. And then go ahead and make sure that we're getting some other extra sources of potassium in your diet, because like I said, when you are getting rid of all of the extra fluid and all the sodium's going out, you're also losing your potassium. So foods such as bananas and orange juice and stuff like that is going to help keep your potassium up.
Okay.
So just to kind of reiterate, what kind of symptoms would you report to your doctor?
Numbness and tingling in my hands, and if I'm really dehydrated or I sense my heart palpating or having a dysrhythmia.
Perfect, yeah. And then I'm going to let you go ahead and have this handout. So just, any of those other side effects we talked about earlier. And if you just feel off at all and you're just concerned that something might be wrong, go ahead and call your doctor, because we want to get it checked out just to make sure.
Okay.
And then what other foods can you eat to kind of help your potassium levels?
Bananas and orange juice.
Perfect.